Good morning, how are you doing? My name's Adrian, I'm a physiotherapist. Next week is National Migraine Awareness Week, and there are absolutely millions of us that suffer from headaches. And my message today is you really don't have to suffer. Physiotherapy is a well-proven modality and method of getting rid of your headaches. How we do that is we assess your neck and your lifestyle. The neck is constructed of vertebra, and the top vertebra in particular, which control most of your range of movement, are often responsible for driving that headache syndrome. We call this cervico-genic headache, and a large percentage of patients that come into our practice, a large percentage of migraine sufferers also have a component of cervico-genic headache. So if we see a patient that's had chronic migraines for many years, quite often we can help reduce a lot of their symptoms by addressing any dysfunctional problems in their neck. How we do that, obviously we look at your whole posture, we look at your range of movement, as we said, we look at your lifestyle factors as well. So how much do you sit, do you drink enough water, do you take enough exercise? And if you're exercising, what type are you doing? Quite often I see patients, weightlifters, cyclists that come in with headaches, so we have to modify what they're doing, modify their posture, their positioning when they're exercising, so that we can reduce the stresses on these areas of the neck. How we do that, we can apply acute therapies, which is manual therapy like sports massage, spinal manipulation, smaller, more gentle techniques, what we call nags and snags. We can also do acupuncture or dry needling, and these are acute therapies, so they can take away a lot of your pain, and sometimes by pure miracle we get rid of your symptoms entirely. But quite often we have to really look at your posture, your muscle balances, the neck muscles, the deep neck flexor muscles, the sternomastoids, scalenes, your upper trapezius, levator scapular muscles, and we have to look at rehabilitating those. Quite often they're weak. If you consider you've got a dysfunction in the neck, and if you've also got neck pain, the muscles aren't going to be functioning all that well. And if you've had that for a period of time, they're going to weaken over time. So we need to have a strategy or a rehabilitation program that rectifies those imbalances. We also will provide you with advice on sitting, how long you should sit for, screen use if you're sitting at a computer, your driving position. We'll look at your sporting activity. So if you're weightlifting in a certain way, we may modify how you're doing that. If you cycle on a bike, we'll look at your posture on the bike. We'll get you in, take a video of how you actually cycle. We may advise some modification of that. So there's lots of different things that we can do. But my main message today is that for headaches and also migraine, if you've got a persistent problem or a persistent migraine, then physiotherapy would be something you might want to consider, and we'd be delighted to help you.